Welcome to the Living with Narcissists podcast, where the first recommendation is don't. But unfortunately, that's not always possible. So this is your haven for validation, insight, strategies, and resources. So let's get started. Welcome, I'm Carrie, and this is the Living with Narcissists podcast. Today's episode will focus on the disorganized attachment style and how it's related to borderline personality disorder, which is one of the 4 subcategories of cluster B narcissism. As a reminder, the disorganized attachment style is the category that describes children with the most significant attachment problems due to their history of abuse and severe neglect. Research has shown that up to 80% of children with a history of parental maltreatment or drug abuse have a disorganized attachment style, and by contrast, only 15% of children from low-risk families have a disorganized attachment style. We learned in Season 2, attachment trauma can result in an attachment issue, or in extreme cases, a cluster B personality disorder. Based on various elements, biology, conditioning, and life experiences, the development of a personality along with coping strategies will evolve. Therefore, the same attachment issue can lead to various personalities because there are as many outcomes as there are grains of sand on the beach. So as you may remember in Season 4, Episode 4, we discussed covert vulnerable narcissism and how that is also related to a disorganized attachment style. And now we're learning that borderline personality disorder is also related to disorganized attachment. And of course, both are subcategories of cluster B personality disorders. It's important to remember that a person can have a disorganized attachment style, a form of insecure attachment, but still not fulfill the criteria in the DSM for a cluster B personality disorder, which is the dramatic emotional erratic cluster. However, when we reduce the observed behaviors to their fundamental elements, all roads lead back to the 9 primary traits for narcissism listed in the DSM-5 as we talked about in Season 1. Before we review the criteria in the DSM-5 for being diagnosed with a borderline personality disorder, we should discuss the controversy around this diagnosis. Borderline personality disorder, BPD, and complex post-traumatic stress disorder, CPTSD, share many features, such as difficulty regulating emotions and an altered sense of self. There is controversy surrounding the relationship between BPD as a trauma spectrum disorder and the validity of the CPTSD as an independent diagnosis. So in other words, is it BPD or CPTSD? In reality, many individuals with BPD possess cognitive and emotional empathy, which would disqualify someone from a cluster B diagnosis. This confusion arises because people with BPD may experience fluctuations in their empathetic abilities depending on their emotional state and the situation. The emotional volatility often seen in BPD can lead some to assume that these individuals lack empathy. Borderline personality disorder makes it difficult for people to manage their emotions. It can cause long-term patterns of unstable or intense emotions that can lead to impulsive actions and frantic efforts to avoid real or imagined abandonment. When in this state of temporary psychosis, which is a fancy way of saying out of touch with reality. The person with BPD can lose their ability to empathize. This volatility results in a pervasive pattern of unstable relationships, shifting self-image, and impulsivity, which begins in early adulthood and is present throughout life in a variety of contexts. The DSM-5 requires that an individual must present 5 or more of the following to be diagnosed with BPD. Fear of abandonment. People with BPD are often terrified of being abandoned or left alone. Minor things, like arriving home a few minutes late, may trigger intense fear and prompt frantic efforts to keep the other person close. They may beg, cling, start fights, track your movements. Why and where are you going? And how long till you return? Or even physically block the person from leaving. And of course, this behavior tends to have the opposite effect by driving people away. Number 2, they also tend to have unstable relationships that are intense and short-lived. They fall in love quickly, love at first sight, believing that each new person is the one that will make them feel complete, only to be quickly disappointed because they expect a complete merger and no autonomy from their partner. They see their relationships as perfect or horrible without any middle ground. It looks like emotional whiplash to other people due to the rapid swings from idealization to devaluation. The next is when you have BPD, your sense of self is typically unclear and unstable. Sometimes you may feel good about yourself, but other times you hate yourself or even view yourself as evil. You probably don't have a clear idea of who you are or what you want in life, and due to a shifting self-image, you may frequently change jobs, friends, lovers, religion, values, goals, or even your sexual identity in a desperate search for self, your true inner identity. The fourth is that individuals with BPD tend to engage in impulsive and self-destructive behaviors. They may engage in harmful, sensation-seeking behaviors, especially when they're upset. They may impulsively spend money they can't afford, binge eat, drive recklessly, shoplift, engage in risky sex, or overdo it with drugs or alcohol. These risky behaviors may help them feel better in the moment, but they end up hurting themselves and those around them over the long term. The next is self-harm, which includes suicidal behavior. Self-harm is what it sounds like. Somebody's hurting themselves, and generally it's through cutting, burning, or even punching yourself when you're frustrated or angry. Suicidal behavior and deliberate self-harm is common in people with BPD. Suicidal behavior includes thinking about suicide, making suicidal gestures or threats, or actually carrying out a suicide attempt. According to research, 8 to 10% of people with borderline personality disorder die by suicide, which is a higher rate than the general population and other psychiatric disorders. Additionally, 60 to 70% of people with BPD attempt suicide at least once in their lives, with unsuccessful attempts, thank goodness, being more common than completed suicides. I had the misfortune of having a family member express many times that they wanted to die and commit suicide. That was a very frightening experience, and I didn't know what to do. After discussing this with my therapist, he said that if this person expressed that again, I should tell them, if you say that, You leave me no other choice but to call 911, which is the emergency number in the United States, because I cannot allow you to say that without taking action to protect you. Once this person knew that if they said that again, I would call 911 to access mental health care for them, they never said that again, and they never attempted suicide. After that experience, it made me wonder why a person would want to kill themselves. The only conclusion I have been able to acquire through my research is that they feel the only way out to end the pain that they are experiencing is to end their life. It's hard to say whether or not the person I was dealing with was manipulating me or serious about committing suicide, but every expression of suicidal ideation should be taken seriously, because if this person actually has BPD, the risk of suicide is pretty high at 8 to 10%. Number 6 is unstable emotions and extreme emotional swings. So unstable emotions and moods are common with BPD, which result in extreme emotional swings. One moment they're happy and the next moment despondent. Little things that other people just brush off can send them into an emotional tailspin. These mood swings are intense, but they tend to pass fairly quickly, usually lasting just a few minutes or hours. Similar to when you distract a toddler with something new, their mood can change almost instantly. So sometimes you can introduce something pleasant into the environment, and that might change their mood because they're very hyperreactive to what's going on around them. So if you could get them involved in something that will elicit pleasant mood, then you might be able to shift things in a better direction. But don't count on it. Number 7, people with BPD often talk about chronic feelings of emptiness, as there is a hole or a void inside of them. At the extreme, they feel as if they are nothing or nobody. This void is where the identity or sense of self should reside, but because they have an unclear and unstable sense of self, they feel empty inside. This feeling is so uncomfortable, they may try to fill the void with things like drugs, food, or sex, but nothing ever feels truly satisfying. Number 8, people with BPD may struggle with being short-tempered and have displays of intense emotional anger. And once the fuse is lit, they may have trouble controlling themselves. They will yell, throw things, and become completely consumed by rage. This anger isn't always directed outwards. It can be directed inwards, as they can spend a lot of time feeling angry at themselves, which leads to self-loathing. And lastly, number 9, people with BPD often struggle with paranoia or suspicious thoughts about the motives of other people, which can make them appear out of touch with reality. When under stress, they may even lose touch with reality and enter into temporary psychosis, an experience known as dissociation. They may feel foggy, spaced out, or as if they're outside their own body, which is also referred to as derealization, depersonalization. This is why the name borderline was given to this diagnosis, because the individual is on the border of psychosis, and they can be triggered into being out of touch with reality when under stress. Borderline personality disorder is rarely diagnosed on its own. There are common co-occurring disorders, which include depression, bipolar disorder, substance abuse, eating disorders, and anxiety disorders. Out of all the cluster B categories, BPD is the most responsive to therapy. When BPD is successfully treated, the other disorders often improve too, but the reverse isn't always true. For example, you may successfully treat symptoms of depression and still struggle with BPD. Some of the experts in the field say that the BPD diagnosis might be framed differently in the next edition of the Diagnostic Statistical Manual of Mental Health Disorders. So there is a lot to learn about this condition, and much of what we know is not engraved in stone. There is more that we don't know than we do, but we are learning more with time. In the notes, I've listed some highly acclaimed books about BPD that can go into greater depth about this condition. Thank you so much for joining me. I hope this information is helpful. If you like my content, please choose to follow, subscribe, or provide a rating so I can share this information with more people and you don't miss out on future episodes. I look forward to sharing more in the future. Have a wonderfully peaceful day. Till next time.